Hey, I know nobody asked, but I'm gonna record a video to show you guys how I'm gonna perform my abdominal and lower extremities assessment. To start, we're gonna walk in, do our hand hygiene. We're gonna let our client know why we're there. So it's to perform our abdominal and lower extremities assessment. Next, we're gonna go ahead and get all of our subjective data and objective data out of the way. After that, we can go ahead and inspect the stomach. So you want to do this at eye level. We're looking for the color. We're looking for any lumps, bumps, bruises, any scratches, any abnormalities. Another thing to look for are any visible pulsations. So if there's any visible pulsations, you do not want to palpate, as this can be a sign of an aneurysm. So after that, we're going to go ahead and go to the end of the bed, to the foot of the bed, and we're going to see if everything is symmetrical. So their umbilical and everything's symmetrical. Next, we're going to go ahead and auscultate for aortic sounds. So when auscultating, we're listening for bruits, so that whooshing sound. So we're going to start at our abdominal aorta. So it's about 2 to 3 inches above your umbilicus, so your belly button. We're going to start there. To your left and to your right, about an inch or two out to your left and to your right, these are going to be your renal arteries. About 2 to 3 inches below your renal arteries, these are going to be your left and your right iliac arteries. Then below your iliac, you have your left and right femoral. When auscultating, you're going to use the bell end of your stethoscope, so the smaller end. After auscultating aortic sounds, we're going to go ahead and auscultate for our bowel sounds. So for bowel sounds, you want to use the diaphragm of your stethoscope, and you always want to start in the right lower quadrant. And you kind of want to go in that zigzag motion. So we're listening. So normal bowel sounds are going to be that high-pitched, like gurgly sound. And then an active rate, so a normal rate for bowel sounds is going to be 5 to 30. Hypoactive is less than 5. Hyperactive is more than 30. If there are no bowel sounds, so absent bowel sounds, one, you want to take note of it. And you also want to listen for 5 minutes. I think of it as a little over a minute in each quadrant. So right lower, right upper, left lower. So about a minute auscultating in those quadrants. Next, we're going to move on to percussing. So for percussing, you're going to take your hand, take your finger, and you kind of want to hit, I hit my middle finger with my other hand. And again, you want to do that zigzag motion. For percussing, it does not matter where you start. I'm just going to go ahead and start in my right lower quadrant though. And you kind of want to go in that zigzag motion and percuss. So a normal sound, normal sound is going to be a high-pitched echo. That's going to be your tympani sound. So that's your normal sound. And then any thud, that's going to be an abnormal sound. This can be a mass, or it can even be a sign of like fluid buildup. So you want to do that in all 4 quadrants. So after percussion, we're going to go ahead and palpate. So when palpating, again, it doesn't matter where you start. I'm just going to start in my right lower quadrant. Nancy said about a half an inch for light palpation, but our pamphlet says about 1 centimeter, but I don't think it really matters. But I think of it kind of like as a caterpillar walk. Again, you're going in that zigzag motion. You're going to fill in all 4 quadrants. And then again, like you're filling for like any lumps or any bumps, any abnormalities. So after palpation, I'm going to go ahead and assess for any umbilical hernias. So to assess for these, you're going to have your client, they're going to be laying flat on their bed, and you're going to kind of have them bring their head towards their feet. I think of it as like doing a sit-up, like a crunch or something, and you'll see the hernias appear in like the same regions that we auscultated for aortic sounds. Next, we want to evaluate their bowel movements. So we want to take note of the color, the size, the amount, and then what number it would be on the Bristol stool chart. Another thing that I forgot to mention for when palpating, we want to note if our client has like any guarding. So like any tensing like of the muscles. This is the body's like natural response to like pain. You always want to ask your client, like, if you notice guarding, if they have any pain in that area. This may not always be the case. It's just the body's natural response to you palpating. So after the abdominal assessment, we're going to move on to our lower extremities. So for lower extremities, we're going to kind of do the same thing that we did for the upper extremities. So we're going to start, we're going to collect all of our subjective data. Next, we're going to go ahead and feel with the back of our hands the temperature. We're going to know if they're hot or cold, if they're wet or if they're dry. Another thing we're looking for in the lower extremities is any swelling or edema. So Nancy gave us that paper. It has like the scale, the edema scale. I want to say it's like 0 to 4, but with edema, you wanna know how fast it rebounds. So is it brisk? Is it fast? Is it sluggish? Slow? For more severe cases, it's gonna rebound in it's gonna take a longer period of time for it to rebound completely. But moving on to the toes, we're gonna check the capillary refill. So less than 2 seconds is good, is normal. You wanna know if it was brisk, if it was sluggish, so fast or slow. Next, we're gonna inspect the whole foot. We're looking for any cuts, any bruises, any lumps or bumps. For your diabetic clients, this is really important because they don't have a lot of feeling in their feet. So if they have a cut, they don't always know. So it's more likely for them to lead to infection because they never knew the cut was there. Next, we're gonna assess Verbinski's reflex. So imagine this is my foot. We're using our reflex hammer. So this is my big toe. So on the lateral ends of your foot, you're gonna do this with some pressure, and you're gonna do it like kind of quick. So you wanna go up on the lateral end, starting at the base of your foot, and you're gonna go all the way up to your big toe, and then you're gonna go over to your pinky toe. So a normal finding is you'll see your big toe abduct, and then I did it on myself, and I kind of noticed like my pinky toe go out a little bit, and the rest of my toes, they moved a little bit. But an abnormal finding when doing Verbinski's reflex is when all the toes flare. That's not good. So next, we're gonna do range of motion. So for the hip, you have flexion, extension, and then hyperextension is bringing your leg back. Then you have abduction, adduction, circumduction. Then you have internal rotation, external rotation. For the knee, you have flexion, and then just standing up straight, this is extension. For your ankle, you have dorsal flexion, and then I forget what the other one's called, I'm not gonna lie. For your foot, imagine this is my foot. So big toe going upwards towards your head, this is inversion. Pinky toe upwards towards your head, this is eversion. So inversion, eversion. And then I think that's it.